Well, today, Governor DeWine allocated $84 million to children's behavioral health services as part of the state's federal pandemic relief money. And a Miami Valley leader played a critical role in securing that funding. 2 News reporter Adam Reif is live in the newsroom with the new information.
Debbie Feldman and advocates say the demand for pediatric behavioral health services exceeded capacity even before the pandemic, then reached emergency levels over the last year. Advocates say this funding will not eradicate the problem, but it will make a major difference.
We have young people in our community that think there's no reason to live. And it's just heartbreaking.
Debbie Feldman says there have been increases in suicides and suicide attempts among young people. 14% have a suicide plan. About half of those children actually try to carry it out. Dayton Children's Hospital first tried to address the concerning trends by expanding existing inpatient and crisis services.
But it's just not enough.
Feldman says this money will help weave together the services in a comprehensive way. An intensive planning process is already underway. They hope to finish in the fall.
How do we use these funds to maximize the benefit of the investments we've already made, and where do we need to add investments in order to try to provide more of a continuum of services for the children in the Dayton region?
And it's clear when Debbie Feldman has something to say.
I received a call from Debbie Feldman, Dayton Children's Hospital, one Sunday, and she says, I have an idea.
People listen.
We all do what Debbie Feldman says.
So the state board worked on a proposal that would address access problems and workforce shortages.
This bill, by signing today, is going to provide a huge investment in both the inpatient and outpatient centers, and from an infrastructure and capital standpoint.
Feldman does think even more money will be needed in the future, but these programs have to start as soon as possible.
The reality is the educational and mental health impact of COVID is going to be felt by our children for years to come. And so we, as their parents and as a community, need to be there for them and provide the services that are needed to overcome.
Now, the Ohio Department of Mental Health and Addiction Services will be in charge of this $84 million program. Debbie Feldman hopes next year's allocation builds on this year's foundation. In the newsroom, Adam Reif, 5 on 2.